Hi everyone, my name is Perez. In today's presentation, I'm going to introduce to you my database and talk about how we can utilize this database to monitor and ultimately improve patient care. To go on, I'd just like to say something briefly about what a diabetes registry is. So, diabetes or disease registries are a searchable list of all patients with a particular chronic condition that often interface with an electronic medical records. A well-designed registry links all members of the patient's health team and provides key information for patients and physicians. The critical impact of a registry is that it allows timely identification of high risk subpopulations, permitting the healthcare team to intensify treatment. So, with that said, this database that I created can be utilized by our healthcare team to provide the best care for our diabetic patients. So, with my diabetes registry, I created five tables total. One table for coronary risk factors, another table that talks about the demographics, another table that talks about the glycemic controls, another table that has information pertaining to microvascular disease, and then the last table has information about the patients. Um, After that, I created some views. So I have a male view, I have a female view, I have a compare PT view, and I have a compare A1C level view. As we move on, I'll talk more about how these views can be used easily and easily accessible in retrieving some important information about a patient's health records. So the first table, which is my coronary risk factor table, this table provides info on the patient's risk factors. This includes the patient's blood pressure and the patient's cholesterol levels. So you can tell, like I did a quick query here, which is select all from coronary risk factors. And then from here, you can tell I get information on the last time we did a blood pressure on the patient. And the blood pressure information or data is divided into two. We have the systolic blood pressure, diastolic blood pressure, the last patient cholesterol level, what the cholesterol value was, and what date we recorded that. So, the second table is the demographics. So, this table provides data on the different payers and how different demographics such as age, income, payment options, and gender can be pulled to determine some risk factors. All right, so this information pretty much provides the physician or the healthcare team with the patient's demographics, which is which insurance this patient has, what kind of job these patients have, what's the patient's gender, what's some of the patient's risk factors in terms of age, how old this patient is, exercises, social status, economical status, and educational, and all that stuff. All this information can be pulled together to make some good, valid, and medical decisions. All right, my third table is the glycemic control table. So this table provides data needed to monitor the patient's A1C level. So all the patient information in regards to their A1C levels is inputted here, making it very and easily accessible to the healthcare team to retrieve information about all the patients that have been seen in our facility for the last couple of years and how they can utilize this information and figuring out if there's a trend or if there's a relationship between age, time of the month, or whatever it is to determine what's the causes of these diabetes and what they can use this information to improve the patient's health outcome. All right, the fourth table is a muscular disease. So this table provides data that can be used to monitor the patient's creatine clearance levels. Um, with this information that is provided in this database, a quick query of this information can help providers make the best drug therapy decision for a patient, because pulling this information can let you know what the patient's creatine clearance has been in the last couple of months or years, and because of that you can tell how this patient's kidneys or livers can sustain all these medications that the doctor is prescribing. So using this information, the doctor can make the best judgments in prescribing the best medication for the patient. Then we go down to my views. So the views, this um picture right on our left uh compares this is a view created to provide information on the relationship between gender and A1C. So you can tell on my right, you can see all the females and you can see the males. This is a quick query to find the results of all patients, both male and female, that have A1C greater than 6.5. So this quick query was able to provide me with all information about all the patients that I've been seeing that have an A1C level of 6.5. So if you're trying to target a particular patient population, this here can help us easily get that information that we want. So this is another view that I created for just all male patients that we have in the facility that are diabetic. So if we want to target this patient population, this view provides us easy access to that information. And the next table is similar, but then all female diabetic patients that we see in the facility. And this table over here gives us a quick overview of all these patients and information that we need if we want to target these patient population as well. All right, so after I created my database, I did a few quick examples to determine how easily and how fast we can access all this information with just a simple query. So this is an example, shows how we can query the database to find the creatine clearance level of patients from January 1st, 2000 to March 1st, 2000. So within that time period, a provider can just go in there, pull up this information, and then pretty much do a simple query to determine within the last 4 months how this patient's creatine clearance level has improved or deteriorated, and then this information can be vital in helping the patient improve their therapy. Another query that I put here is just a quick one that provides information that can be used to track patients' A1C levels in the last 6 months. So I did a simple query here and a simple statement trying to query how we can get information on all the A1C values of patients in the last 6 months, starting from July 2019 to December 2019. So if we trying to target a set population and to determine what their A1C values are, this provides us with a quick way of finding what that information is. After I created my database, I went ahead to grant some user accounts and some privileges. I granted 4 user accounts and privileges total. I have my root user, which is the administrative, which has administrative privileges to all. I have my backup user that performs database backups. I have my user that I named Brooks, that can enter and modify but cannot delete data. I have my user that I named Martin, that can only access created views. So this is a quick example of my table. So this is for my backup user. So pretty much you can tell right here that my backup user can has the role to insert, to reload, to update, um, and most importantly, to reload. So if we have to do a backup, the backup user needs that function to reload all the information that we lost or we could have potentially lost. So that's the key role of the backup user. And then here we have my user that I named Brooks. So Brooks will have access to modify data, but cannot delete any data. So if you look on here, Brooks have access to select and to do all that stuff, but does not have access to delete data. The third backup is user is Martin. So Martin can only access the created views that I did. So Martin can only see views which I just did that compares the A1C level, and then that can compare patients that have A1C greater than 6.5 in the last 6 months. So Martin has the role to see all those views and doesn't necessarily have access to all the database information that I have. So after that, I did a quick test query, which is a really short one that says show grants for Brooks. And just this query can pretty much tell you every row that grants that Brooks has. So on here, it tells you that he has access to all this information and all these tables. Like you remember that I said, Brooks has access to modify and to do changes, but cannot delete any data. So I just did a quick test to make sure that all the access that I granted Brooks was what I requested for. All right, so this concludes my presentation. This presentation briefly talked about my database. I talked about how we can use this database to monitor our diabetic patients and ultimately help use this to help improve their patient care. So this database pretty much has all the information that we need with just a few clicks and a few queries that can provide our providers and our healthcare team with the information that we need to make the best clinical judgment. Um, Thank you for listening to my presentation. Once again, my name is Perez. Thank you.